Here is here again. Okay, I just can you read it? Projection, we do it all the time. Can anybody give me an example of projection?
This is your fault. You're not listening to me.
Or in marriage, one of the projection is used a lot when one spouse usually accuses the other of infidelity. You're cheating on me. And I had a client with that situation. It's projecting quite a bit apparently on the screen.
Okay. Do you do are you guilty of projective defense mechanism? We all do, right? We all do. Teresa, give me an example.
I'm so perfect.
Huh?
I'm so perfect. Because you're so perfect. I just did it. I'm projecting my perfectionism over to you.
Usually, for example, give a personal example. Okay, see when my older son is younger, teenager. Okay, teenager is difficult to handle, right? So usually when I should correct him, even before I open my mouth, he will sit and say, "Don't be angry." I said, "What? I'm not angry with you. I'm just trying to talk to you." That's preemptive strike, right? He's angry with me. He projects the feeling to me. Say, "You're angry with me." He's a teenager. He doesn't realize. I mean, how am I do the same thing, right? Can you give me an example of my wife? Can you give me an example? Due to projection?
No.
No? Sometimes she will say, she'll mad with me for some reason, okay? Then she say, "Don't be mad." I say, "What?" I say, I'm not mad, I'm just doing something. She will project her anger to me, say, "If I'm mad." It's very common, right? So you got that now?
He is such a perfect husband.
So do I do projection on you? Well, guilty of projection is very common, okay? We all project our needs, our feelings on other people, okay? Other projection, okay? Now, projective mechanism, okay? Now, we tend to see what we expect to see according to our mental state and act towards other accordingly. What does that mean? Do you see me? Do you see me? No, you don't. You see what you expect about me. See? We see what we want to see. We don't see what's out there to be seen. We often see. So here's a danger, right? But I see it. That's what I witness. I witness black versus white, okay? I witness a car is often wrong. The black people expect to see white police abuse the black, okay? So they see the police do all kinds of things. The white police expect the black teenager he can do bad things. So even they are not doing bad things, they see them doing bad things. So we do not see reality, we see what we expect to see in our own head. So that's the danger. You know, when husband and wife come in the same situation of family therapy, everybody have a different account of what happened. Because everybody see the thing from their expectation, their perspective.
And everybody's right.
Uh-huh.
And everybody's right.
Everybody's right. But there has to be some. See, here the trick is that everybody's right, but everybody cannot be all right, right?
That's right.
So the trick is that how to get everybody to realize that there has to be some reality out there. Do you know what is the hallmark of mental health? A sense of reality, right? The more you behave and think according to reality, the healthier you are. So family members need to see what actually happened. If they have doses of reality, there'll be more agreement. If everybody sees things from their own fantasy, there's no solution for marital conflict, for family conflict. Yeah. All just fight like that. To each believe they see something in another person which is not there. So projective mechanism can be very, very damaging. Okay. Now, what's different between projective technique and projective identification? I'm telling the concept of the office inference. Okay. Forcing attribute to another person the feelings, thought of self, but by the fact that the individual does not fully disallow objective, it's just viable reaction on a person. Frequently, the individual include those very feelings to others that were believed to be there. That is very complicated. Do you understand that?
No.
It's it's a very difficult concept. Okay? Let me see this a bit clearer. Okay? Here are two people. Okay? This guy is worried about gaining weight. And we call him Mark, okay? There's actually a case about this guy. So Mark is gaining weight. So when he sees John, he say, "Oh, you're getting fat." John is not getting fat, but Mark is getting fat. There's actually a case there. So he's projecting his fear of always onto the poor innocent victim, John. See, you are getting away. Guess what? After Mark's gone, John looked in the mirror and said, "Yeah, maybe I am. Maybe I'm bloated." So he is identifying with the projection Mark put on him. He identified with that. Do you see what's happening here? Right? So Mark projects this fear of fat onto John. And John unwittingly accept that projection, identify that with that, and really worry about himself getting fat. Okay. So this kind of projective identification often work in a clinical case in terms of transference. Okay. So any question about this slide? Get some idea now, all right? So not only project something on you, but you actually identify with that projection. You really think that you're fat. Any question? Now here's another case. Here's another projection to call anger projective identification. She hate herself. And then she said to the daughter, I hate you. Now where did the mother get this idea of she hate herself? The grandmother goes that one further. The grandmother told her, I hate you. As a result, she hates herself. She hates herself, and this hate projected to the daughter, so it's transgenerational, right? The grandmother passed on to the mother passed on to the daughter. Do you follow the logic? It's transgenerational. Why on earth should somebody hate themselves? Somebody told me, I hate you. It's not worth it. So the voice, they were part of the experience growing up, right? So that voice becomes their identity. I'm hateful because my mother said, I hate you. So that becomes a self-identity of poor self-esteem, of self-loathing. So that kind of self-hate sometimes will project it on to her daughter. Pass on. So the phenomenon of transference is that unconscious transfer of feeling attitude from the past of the person to the present. So usually it's from the past, but the key is what? The key is that you transfer the feeling not only to the present, but to a situation totally inappropriate. You're transferring an attitude feeling that might be suitable in the past, but now you transfer the situation, in constant situation, that's totally inappropriate. And so either they will talk about borderline personality. See, a person with borderline personality disorder or problem is most likely to be guilty of this transference because they have difficulty differentiating reality and fantasy. So real difficulty. So therefore, they're more prone to transfer past experiences into the real situation. So the patient unconsciously projects a wish for a met need in the past to a therapist. Okay. If you have an unmet need for love, okay, you grew up, your father never loved you. So what may happen if you have a therapist who is fatherly, who is kind? So it doesn't take a stretch of imagination to say she might develop fondness to the therapist. Now, is that wrong with that? Nothing wrong with that, yeah? You're fond of your therapist, you like your therapist, but there's wrong with that. But it becomes wrong when you actually obsessed with therapist, manipulating and hoping that he will identify with the role you project on him and will love you back. Okay? Love you back. For example, in hospital, the nurse will say, we're able to trick the doctor saying that, do you like me? The doctor, oh yeah, you're a nice person, I like you. The doctor, they innocently say, I like you because you're a good patient. The doctor doesn't know what's going on in her head, right? The next thing you know, she'll tell everybody that she loves her. In projection, right, but she loves the doctor, she's able to trick him to say, I like you. So that liking become an obsession. And he turn around and say, oh, the doctor's in love with me. That's the communication.